Hello, everyone. My name is Aparajith Kannapiran.
I'm Katelyn Dockery.
And I'm Brooke McArthur.
Today, we're going to be presenting one of the needs that we discovered during our shadowing program under Imaging Clinical Immersions Gastroenterology, vision and suction occlusion prevention during endoscopic procedures. Over the course of the past few months, we've been shadowing gastroenterologists at DelMed, and we've witnessed procedures like EGDs, enteroscopies, sigmoidoscopies, ERCPs. Many of the procedures that we spend most of the time doing are colonoscopies and pancreatic necrosectomies.
In our time observing these procedures, a major need that we identified was the need for a way to emulsify large chunks of matter into small particles to improve suctioning. The suctioning port of an endoscope is a large limiting factor for stool, blood clots, and necrotic tissue to be suctioned. Reducing the size of these particles will allow for improved suctioning and visualization within the body. This affects patients who are undergoing necrosectomies, upper endoscopy procedures like EGDs, and colonoscopies. This leads to reduced visualization within the body and difficulty extracting necrotic tissue. So this presented itself in colonoscopy procedures through inadequate bowel preparation, which reduces diagnosis of colorectal neoplasia and increases post-colonoscopy colorectal cancer risk, which the whole point of a colon cancer screening is to identify these risks. So this is a major problem. 30% of patients referred for colonoscopies have poor bowel cleansing, which you can see according to the Ronchik scale for bowel prep on the right. The poor and inadequate images are what we're dealing with in these procedures.
We also saw quite a few pancreatic necrosectomies, which is where a scope enters the patient via the esophagus and an incision is made through the stomach in order to remove all the dead tissue aggregations throughout the pancreas. We noticed that scope suction does not accept large pieces of tissue, which required the physician to have to spend a lot more time breaking up the tissue before they could remove it.
So physicians have attempted to rectify the situation through a couple existing situations. The first of these is a trapezoid basket, which is originally designed to inflate and crush large stones within the body. Dr. Agarwal, one of the physicians we were shadowing, has stated that this can also be used in the case of pancreatic necrosectomies to cut large bits of tissue into smaller pieces of matter, but this is not a preferred option because it's time consuming and it's not the original function of the device, so it's not as effective on tissue as it is on large stones. A couple other options that physicians have been using are using the polyp snare, which is intended to remove polyps and necrotic tissue. They use this to grab onto the tissue and rip it into chunks by wrapping it around it. But again, the intended use of this is primarily for polyps, and so it's not as effective. Finally, physicians can also use biopsy forceps, which are typically used to gather biopsies of the colon wall. These collect relatively smaller samples, and this is not an ideal solution for them to use because, again, the tissue is quite large and needs to be reduced into matter that is of the appropriate size to fit into a suction.
So as a result of these observations, we identified some key customer needs. We want to create a product that is easy to use, that fits through the endoscope port with ease, so already works with current technology. We want it to be able to reduce matter size in minimal time, and we also want it especially to grip and move particles of matter. So in response to this, we have a proposed design functionality. By modeling after current technology, which is where as you push down on the pump, it can target the object that you're trying to break up. And then by pulling the pump back, you can reduce the size of the object.
So in summary, we identified the need of a device that will be able to reduce the size of various bits of matter during procedures, particularly colonoscopies and pancreatic necrosectomies. And we've noticed that it's difficult to do with existing products. We're hoping to adapt these existing products and redefine their purpose such that size reduction is possible, and this will improve patient efficacy, allowing physicians to better see and identify problems within the body. Thank you.